Morning. Today we have the honor of being down at SickKids, and we are with Dr. Lindsay Freud. What led you to specialize in pediatric healthcare?
So it was interesting because I always wanted to be a doctor when I was growing up. Coincidentally, when I was 12 or so, a friend of mine ended up being diagnosed with heart disease, which is a really significant event in those formative years, 12, 13, 14. Then when I was in medical school, I was fortunate enough to find a wonderful mentor as I was rotating through pediatric cardiology. This was at Harvard Medical School. And my mentor is Dr. Wayne Turetsky, and he is a specialist in fetal cardiology specifically. And so I ended up spending a lot of time with him and doing research with him specifically on fetal cardiac intervention, which is when we try to modify the heart disease in the baby even before birth. And the rest is history. I became really enraptured and was fortunate to have a lot of support and guidance, and also, it has been an incredibly meaningful and rewarding aspect of what I do as a pediatric heart doctor.
Can you tell us what you do at SickKids? Can you provide us some insight on what you do here?
So I'm a pediatric cardiologist, a pediatric heart doctor, and I have specific expertise in what we call fetal cardiology. And fetal cardiology is when we diagnose heart conditions in the unborn baby. And many times it's about counseling families and supporting whatever decisions they would like to make about the pregnancy. And from a research standpoint, I have a particular interest in fetal cardiac therapy, so ways to modify the heart disease so that the baby has a less severe condition by the time of birth. We're also interested, and we're working Ontario-wide on trying to understand which pregnant patients are receiving a prenatal diagnosis and which ones are not. And so making sure that we have really equitable access to fetal echocardiography expertise for those pregnancies that are at risk. So it's both at the individual patients with novel therapies, and from a broader public health perspective, how can we identify these babies so that they are delivered in the appropriate location and receive all of the most important care in those first couple of days as they transition to newborn life.
And can you tell us a little bit about what the Fetal Cardiac Fellowship program is?
The fellowship program is something that we are incredibly proud of. One of our missions as academic leaders and at institutions such as SickKids is to not only be refining our own expertise and moving the needle forward in terms of progress, but also to train the next generation of doctors to have the specialization that we do and to be able to provide that care to patients throughout Ontario and worldwide. So we've had a combination of both Canadian fellows as well as international fellows who, we plant our seed, if you will, and disseminate that knowledge to try and make our impact for patients as broad and meaningful as possible.
What impact does the Policaro Foundation have on the Cardiac Fellowship?
Policaro Foundation supports the salaries of that particular fellow, and we have been fortunate enough to recently have received a renewal gift from the Policaro Foundation to support another 5 years of trainees. It's so important because there's often not enough resources and funding that's devoted to subspecialty expertise. So even though it's really critical, there aren't natural avenues to support those fellows as they seek to get that additional subspecialty training. So it's immensely important for us because then we know that we can train someone each year without having to rely on, other competitive grant mechanisms or, trying to scrounge up money at the last moment for an interested trainee. So it really is it really is very impactful, I think, not just for our program here at SickKids, but for the future generations of doctors that we train.
What type of training the fellows go through during the program?
It's a 1-year fellowship, and this is typically for doctors who have already completed their pediatric cardiology training. Occasionally, we also have high-risk obstetrical trainees that want to also refine what they understand about the unborn baby's heart. So it's a 1-year fellowship. It's mostly a clinical fellowship. So they spend time with us as we bring in these women. We diagnose the heart condition, we counsel them, we follow them throughout the pregnancy. And so the fellows are really learning the kind of work that we do day in and day out. And they're also, of course, involved in educating others about fetal cardiology and doing research with us to try and figure out the next best approach that we can have for our patients.
What do you feel would be the most rewarding thing about working with these fellows?
So, one of the things that brings me the greatest satisfaction is when I hear one of our fellows either diagnose or, more importantly, speak to a family using the exact kind of language that I use when I counsel families prenatally. It is by far and away the most difficult thing I do, which is to counsel families about a major heart diagnosis in their unborn babies. During the first half of the year, the fellows are observing us and sort of learning in that kind of way. And as the year unfolds, we gradually allow them to take over the counseling. And when I hear them phrase things just like I do or explain things just the way I do, that expression that imitation is the best form of flattery is true. No, but it really is very heartwarming when I see them engage and care for patients with the same compassion and knowledge that I think that our team of doctors brings to these families every day.
And for these families that are here going through a difficult time, what initiatives does SickKids take to ensure the mental and emotional well-being of its patients?
It's not just about an expert fetal cardiologist providing a diagnosis. It's about a multidisciplinary team of people from various backgrounds and that really support these women throughout their pregnancy. While the initial consultation is with a cardiologist and a fellow present in the room, or Policaro fellow, if not additional fellows sometimes who want to observe. We always have a nurse in the room with us as well, and our nurses are specialized and trained in understanding pediatric cardiology. And so after the doctors leave the room, the nurse actually goes back with our documentation and goes through it again in layman's terms, because part of it is just making sure they really understand what's happening with the pregnancy. And then our nurses, and we have really, really incredible nurses as well, they follow up with families and liaise them with social work for families that need to relocate to Toronto from all over Ontario and Canada, resource navigation, and we identify other providers who may be instrumental in helping the families cope through what may be one of the most difficult times of their life.
What advice would you give to aspiring pediatricians who want to make a difference in children's health care, in particular in fetal cardiac care?
Well, I would love if everyone was interested in pediatric cardiology, specifically fetal cardiology. I really think it's a wonderful field because it is very diverse. And so there is an imaging component, there's a counseling component, there's an interventional component. You learn how to manage patients from the outpatient setting to the intensive care unit, and you watch them as their story unfolds. And when we have the privilege of following them from the time that they were diagnosed in the womb and watching them grow up and become children and then mature adolescents and then transition them to adult care, it is one of the most rewarding aspects of my life. To be able to care for families both before and after the birth provides a really unique bond. The parents, it's not just their gratitude, but the connection that you've established with them from having given them the diagnosis prenatally and then following them is really rewarding and enriching. And I think the fellows also perceive that, the Policaro fellows, and they really lean into that emotional connection that then carries them forward, and I think also creates a generation of really compassionate physicians.
Are there any ongoing or upcoming research projects at SickKids?
Our current Policaro fellow, Josh Greisman, is working on, he actually just presented on it a bit this morning during our Ontario-wide fetal cardiology rounds, where we're educating folks throughout the province. And what he and I have been looking at is the use of medications that we give to the mother that then pass through the baby in unborn babies that have specific types of tumors or masses in their hearts. These aren't cancerous, but they are growths that can cause difficulty with blood flow getting in or out of the heart. And so we recently used this therapy for the first time under a new set of circumstances, and we hope that that will be published soon. And we're also looking at the collective experience of using these types of medications to treat these tumors we're gathering information from all of the patients that we've treated at SickKids, as well as with many other centers that have sought our expertise in this matter, and we're gathering all of that data to provide what we hope will be, the largest case series of this kind. It's very enriching to bring the fellow into that experience for both clinical care and research, as well as education. And as busy clinicians with lots of activities ongoing, that Policaro fellow who's able to devote time to help us further our research and educational missions is really, really impactful.
Thank you for joining us today. We typically raise funds for the Policaro Fetal Cardiac Fellowship through our track day. And Dr. Freud was lucky enough to be there last year and get in some of our race cars. Mm-hmm. And we hope to do that again next year to continue to support the hospital any way we can.
I can't wait to get into that race car again. It was fun.